One spoon of food given with love can sometimes undo weeks of rehabilitation after a stroke. A family member says doctor has stopped oral feeding, but just one spoon won't hurt. I know it comes from love, but let me explain why this can be extremely dangerous. After a stroke, many patients can no longer swallow safely. This is called dysphagia. So, the muscles involved in swallowing become weak, slow, and poorly coordinated because the brain can no longer control these muscles. Normally, when we swallow, food goes into food pipe and airway closes to protect the lungs. But in the stroke, food may enter windpipe, which may lead to aspiration. Even more dangerous, some patients when they swallow they don't cough at all when it goes to windpipe. So this is called silent aspiration. So now when this food or liquid enters the airway, it leads to aspiration pneumonia, a serious and life-threatening infection. This is exactly why doctors recommend Ryle's tube, nasogastric tube. Ryle's tube is not a punishment, not a end of the recovery. It's a temporary protective bridge that provides hydration, nutrition, and medicines while your swallowing muscles recover. Here's what many families don't know. Swallowing is a skill that can often be rehabilitated, but it needs proper assessment and training. Just because a patient looks alert and asks for food, that doesn't mean that patient is ready to swallow safely. Before the oral feeding begins, the patient must undergo detailed swallowing assessment. This is where a speech and swallowing therapist plays a vital role. They carefully assess whether the patient can swallow safely and then begin with the exercises to strengthen the swallowing muscles and retrain the speech, tongue, cheek, and the throat. Only when the patient passes the thorough swallowing assessment is the oral feeding introduced. Even then, it is gradually started with the safest food textures. I will also talk about the tracheostomy in the next video. Please stay tuned.